Hey, I'm Dr. Kolahi, and I'm an orthopedic surgeon with a specialty in hand and wrist. So I treat primarily hand, wrist, and elbow as well. Trigger finger is a very common condition, and the problem is in the tendon of the finger. So the tendons, come into the finger and they kind of pull like little ropes, like marionettes, to flex the finger. And it works pretty well, almost all the time, except in trigger finger, what happens is that the tendon gets stuck inside its sheath that we call a pulley. And instead of gliding easily inside that sheath, the tendon can get swollen and have inflammation and a nodule, and it can get stuck in that sheath. And when that happens, the finger is quite painful and can actually get stuck. People can have the finger sometimes stuck down, and in the mornings, patients will typically have the worst pain where the finger will get stuck, it'll catch, it'll be stiff. So for trigger finger, there's a few ways to treat it. Typically, try to treat it conservatively first. Sometimes if the trigger finger is new, you can do stretching or splinting at night and taking an anti-inflammatory, and that can help the swelling go down and help get rid of it. If that's not doing the trick and it's not getting better, typically a corticosteroid injection is tried. That can bring down the inflammation of the tendon, which can resolve the triggering. And the last resort for trigger finger is a small procedure where you open up the sheath to release the pressure on the tendon. Arthritis at the base of the thumb is a very common condition. Arthritis is basically when you wear down the cartilage lining of a joint, and cartilage is what allows the joint to have a smooth, slick surface so that you can move without noticing anything. But as you wear down cartilage, it becomes rougher, becomes more painful, and eventually it could just be bone rubbing on bone, which is quite painful. And the reasons people get arthritis are genetics is a big factor, aging, and then use. Things like doing a lot of activities that involve high grip, opening jars, even turning keys can aggravate it. Once you have arthritis, there's really no reversing it. Once you lose cartilage, it's kind of like treads on a tire. Once it's gone, it's gone. But there are things that you can do to manage the pain. Arthritis in and of itself is not dangerous, so if it's not too bothersome to you, there's nothing wrong with essentially doing nothing and living with it as long as you can tolerate it. But if it really becomes bothersome to patients, when they're gripping or turning keys and it causes a lot of pain, there are things that can be done to manage the pain, and typically the treatments are conservative, things like wearing a brace. If a brace or taking medications isn't helping, sometimes a steroid injection can help alleviate the pain. And for patients where conservative management has failed, there's a surgical procedure which is pretty successful at relieving pain there. Typically, patients with carpal tunnel syndrome which start with conservative management, and typically what I recommend is to wear a wrist brace at nighttime only. Not during the day, but just at nighttime. And what that does is it helps keep the wrist straight. And when we go into REM sleep, we typically tend to flex our wrist, which increases the pressure on that nerve. So wearing the brace, all that does is just keep the wrist straight and keep some of the pressure off the nerve. If the brace is not helping and the condition worsens, then things that we can try are a steroid injection sometimes. And for people where conservative management has failed, a surgery to release the pressure off the nerve is performed. And that's about a 10-15 minute procedure. Tennis elbow is a painful, overused tendonitis type condition at the outside part of the elbow. And patients will typically have a lot of sharp pain at the outside part of the elbow with, things like lifting, but even simple things like typing can cause a lot of pain there. And it's typically thought of as an overuse condition. It's called tennis elbow because a backstroke can put a lot of pressure on the tendon at that part of the elbow. But most people who get tennis elbow don't play tennis, and a lot of activities can aggravate that tendency. Even just typing frequently or frequent mouse use can aggravate that part of the elbow.